If you've ever stood under those harsh fluorescent store lights, just totally overwhelmed by a sea of colorful bottles making miracle promises, well, you are definitely not alone. Today, we're cutting right through the confusion. We're going to break down the real, hard science of skincare into practical, everyday advice you can actually use at home. No exaggerations, no impossible claims, just trusted, science-based health tips to help you build a routine that literally works. So, let's dive right in with a pretty tough question. What does dermatologist approved actually mean? Well, here is the uncomfortable reality. As Dr. Nelligrillo points out, legally, it means absolutely nothing. Seriously. Unregulated marketing terms like dermatologist approved, clinically proven, or even medical grade have zero standardized regulatory definition. There's no peer review required, no robust clinical trials, and no oversight by any official dermatologic authority. These phrases, they're just carefully designed to sell, not to educate us. So if we want to find products that actually do what they say, we've got to look past the front label hype and start looking at the back. And that brings us to a massive skincare myth. Dr. Rebecca Caussin from the American Academy of Dermatology brilliantly illustrates this with a joke. She says, poison ivy is all natural. It's so true, right? Just because a label screams clean or natural absolutely does not mean it's safe or better for your skin. In fact, a lot of plant extracts and essential oils are leading causes of contact dermatitis and irritation. We kind of need to rewire our brains to stop equating natural with automatically good for you and start judging products based on their actual chemical formulation. Okay, so how do we actually read a label like a pro? First up, totally ignore the front label. Just turn the bottle around. Ingredients are listed in descending order by concentration right up until they hit the 1% mark. That means those first 5 to 7 ingredients, they make up the vast bulk of the formula. If a brand is hyping up a hero ingredient but you find it dead last on the list, yeah, its clinical impact is probably going to be minimal. You want to identify the active ingredients, avoid synthetic fragrances because those can really trigger sensitive skin, and remember that a simpler formula with well-studied ingredients is often way better than a complicated one. Now, before we start choosing products, we really need to understand what we're actually trying to protect. Let's talk about transepidermal water loss, or TEWL. Think of your skin barrier as the roof of your house. When that roof is compromised, when it gets leaky, all your precious moisture just escapes right into the atmosphere. That is exactly what happens when your skin loses its natural defense mechanism. It leads directly to dry, flaky, stinging, or irritated skin. So our goal with moisturizers isn't just splashing water on our face, it's literally patching up that leaky roof so the moisture stays trapped inside where it belongs. Let's apply this leaky roof concept to two absolute giants in the skincare aisle, CeraVe and Cetaphil. The trick here is matching the product to what your skin is currently doing. If your skin barrier is cracked, flaking, and just screaming for structural repair, clinical audits tend to lean towards CeraVe because it's packed with heavy-duty barrier-repairing ingredients. But if your skin is just angry, highly reactive, red, or super oily, you might want to opt for the minimalism of Cetaphil. It focuses on maintaining a healthy barrier without introducing complex actives that might accidentally trigger a flare-up. I mentioned that CeraVe uses barrier-repairing ingredients, and the star players there are ceramides. Let's define what those actually are. Ceramides are natural lipids, or fats, that already make up about 50% of your skin's composition. If you imagine your skin cells as bricks, ceramides are the mortar, holding them all tightly together. When your ceramide levels drop, bam, you get that leaky barrier we just talked about. Products that utilize ceramides are literally patching up the microscopic gaps in your skin, keeping the bad stuff out and the hydration firmly locked in. But hey, those ingredients only do their job if you're using the right texture for your skin type. The American Academy of Dermatology has a really actionable tip for this. If you've normal to oily skin, or if you're sweating through humid summer weather, a lightweight, water-based lotion is usually all you need. But as we get older, our skin naturally holds on to less moisture. So if you're over 50, perimenopausal, or battling through brutal winter dryness, you need to ditch the lotions, upgrade to thicker, oil-rich creams, or even heavy ointments to physically plug those leaks. And here's a super practical, everyday tip from dermatologists that you can literally use tonight. Apply your moisturizer immediately after you step out of the shower. Don't wait. When your skin is still damp, those thicker creams and ointments spread a lot easier. But more importantly, they physically trap that shower water right into your skin, stopping it from evaporating. It is such a tiny, simple timing adjustment, but I promise you, it makes a massive difference in how hydrated your skin feels all day long. All right, let's transition from basic hydration to the absolute heavy lifters of skincare, the actives. And when it comes to actives, retinoids are the undisputed king. We're talking about vitamin A derivatives that have over 50 years of solid clinical data backing them up. They work by actually speeding up your surface cell turnover. So whether you're trying to clear up stubborn acne and clogged pores, or you want the absolute gold standard in anti-aging to smooth fine lines and stimulate collagen, retinoids are where the real science is at. But because retinoids are so powerful, we really need to handle them with care. Since they rapidly increase that cell turnover, they can leave your skin barrier feeling raw, peeling, and irritated, especially when you first start using them. So caution is absolutely crucial here. You've got to introduce retinoids slowly. Maybe just start with a couple of nights a week to build up your skin's tolerance. And always, always follow it up with a really great ceramide-rich moisturizer to fight off that dryness and keep your barrier intact. Now, while we are on the topic of active ingredients, I need to briefly but directly highlight a major safety warning. The FDA and health departments strongly advise everyone to completely avoid unregulated skin lighteners. It's actually really scary, but many of these illicit products have been found to contain highly dangerous, toxic ingredients. We're talking mercury or unprescribed super potent steroids. Please always stick to trusted, well-formulated products and definitely consult a doctor if you're looking to safely treat stubborn hyperpigmentation. Let's shift gears for a second and look globally. Over in South Korea, their whole approach to skincare is just fascinating. In Korean culture, there's a popular saying that skincare is as routine as getting a haircut. There is zero stigma around taking time for your skin, for men or women, treating daily hydration and sun protection as a completely normal, essential habit rather than some tedious chore or a luxury is essentially the foundational secret behind their famously clear, glass-like skin. So let's look at how this builds a perfect canvas for your face. One of the absolute best imports from Korean skincare is the double cleansing method, which you typically do at night. First, you go in with an oil-based cleanser or balm. This gently melts away stubborn things like water-resistant sunscreen, heavy sweat, and excess sebum, all without any harsh scrubbing. Then, step 2, you follow that up with a gentle water-based face wash to sweep away whatever impurities are left. It cleans your skin so deeply, but without stripping away that precious moisture barrier we've been talking about. Okay, we have covered a lot of ground today. Let's synthesize all this science into a super simple, actionable 4-step daily routine that anyone can easily pull off at home. Step 1, use a gentle cleanser to prep your skin. Step 2, apply your targeted active, so maybe a vitamin C serum in the morning or a retinoid at night. Step 3, put on your moisturizer to lock it all in. And step 4, which is absolutely non-negotiable for the morning, a broad-spectrum SPF 30 or higher to protect against aging and skin cancer. See, you really do not need a 20-step routine to get clinical results. Before we wrap things up, I have to share this surprising but incredibly practical tip from Dr. Kazan for anyone out there with combination skin. Ready? You do not have to put moisturizer over your entire face. It's true. Treat your face like it has different zones. Moisturize the dry spots, like your cheeks, for sure, but feel free to skip the oily spots, especially your T-zone. As Dr. Kazan points out, it's a huge revelation for people to learn that their nose probably doesn't ever need moisturizer. This one simple adjustment can save you from so many unnecessary breakouts. So as we finish up, I want to leave you with a question to think about. What is your biggest daily skincare hurdle? Is it finding the time, figuring out the right ingredients, or honestly just remembering to put on sunscreen? Look, by treating skincare like the science it actually is, by ignoring the flashy marketing, protecting your skin barrier, and sticking to a simple routine, you can completely transform your skin's health. I really hope this explainer empowered you to make smarter, more confident choices next time you're in the skincare aisle. Follow for more real health tips.